aim of universal health coverage is to ensure that everybody, everywhere, have access to reasonable quantity and quality of health care where they need it without suffering any untold hardship financially. And so we stratified the coverage into the formal sector and the informal sector. The formal sector speaks to the civil servants under the FCT administration and the area councils, and also organized private sector that employ more than 10 people are also classified under the formal sector. Now, the informal sector looks at the small and medium scale enterprise, individuals, families, and small groups or organizations.
The FCT Health Insurance Scheme, like we all know, is a state social health insurance scheme for the FCT residents. Even though of late we are ready to accommodate anybody from Nigeria that is ready to come under the scheme for his healthcare needs under the insurance. So far we have enrolled about 130,000 lives, both formal, informal, and individuals that will come in groups.
We've done quite a number of efforts to ensure that people are enrolled on the informal sector. One of them is to do sensitization programs into markets, to schools, and to some other group of people. We have used the traditional rulers, we gather people in their palaces to speak with them. We have used the religious people. We have been to mosques and churches to talk to them. We have also partnered with the National Orientation Agency to also assist us in this. We've also partnered with the FCT Microfinance Bank to ensure that when people are willing to enroll on the FCT Health Insurance Scheme and they don't have money, they can actually approach the bank to loan them money, and the partnership is still on.
Part of the sensitization drive again is we have a bulletin. Every quarter we have meetings with the Health Maintenance Organization, HMOs under us, and HCPs or HCF healthcare providers. We meet quarterly to discuss the problems, the bottlenecks that our enrollees have coming to report, and we tell them this is what this enrollee said about this hospital or about this HMO. What have you done about it, or what are you going to do about it? So all these activities are packaged and published in our bulletin.
I've been with them for 7-8 years now, but the main problem I'm having with them is with the hospitals. They're not treating us, the customers, well at all, especially if you are carrying a card of FHIS.
We conduct a lot of visits to a good number of our healthcare providers, trying to see the quality of care being given and the kind of reception our enrollees are having with them. Of course, we also go there when we have complaints to go and resolve it there and then, or if it has to be done through a phone call, of course we do it. Then if we have to sanction, we sanction. We have had a case where we delisted a particular facility from further attending to our enrollees because there was persistent denial of service to virtually all the enrollees we have with them. So we had no choice than to delist that facility.
My experience with FCT Health Insurance Scheme, FHIS, I have not encountered much problem with them. I like the scheme very well, you understand? But the only challenge is that at times when you get to the hospital, it's not all the drugs the scheme will just cover. That is the only thing. I have not encountered any problem with them. I like the scheme.
The greatest challenge that I have observed is the trust that people don't have in insurance, general insurance. The perception that you don't pay when you are not sick is a big challenge to convince people. The religious leader are not also helping matter. They don't let the people understand the fact that no matter who you are, no matter where you are, no matter what you have, health challenge is not the respecter of anybody. Number two is the funding for those that cannot afford, because there's no way you can achieve universal health coverage if you have not adequately and sincerely and honestly planned for the poor and vulnerable, for those that cannot access these services. Now, if you can secure reasonably very well those poor and vulnerable, then we can begin to talk about attaining universal health coverage.